Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine, that is Kaya Chikitsa, and MD in Ayurvedic physiology, that is Kriya Sharir. For paid online consultation, you can definitely WhatsApp me on 922681060. My dear friends, today we are talking about the measles, but this is a part of course, you know that Ayurveda in general practice, this is a series that I am running for nearly 55 types of videos of the different health problems. This measles is a basic problem of the children mainly. Of course, it can affect at any age, but measles is very common in the children and especially in the winter season. Try to understand, actually, in this measles, there are typical features. This is a viral infection and it is from one child to the another child. That's why if your child is exposed in the school with another child having the measles, actually that's what I am requesting, that whenever the child is getting measles, don't send this particular child to the college or to the school. Never. You should not go out of the, because it is a droplet infection and that is carried from one person to another. So it makes epidemic. Sathi che azar, epidemic. So be careful that we should not be exposed and we should protect the society from this epidemics of the measles virus. Okay. So there is a basically rash. Measles and chickenpox. Always there is a confusion in the mind of a common man, also with the doctors, sometimes with the students, especially. The measles are and chickenpox both have the rash, but measles rash, typical rash, is on the fourth day. Remember this: measles rash on the fourth day, chickenpox is on the first day. Generally, measles are maculopapular maximum, but in the chickenpox, there may be what we call as a Marathi, it is called as a gover, and another is a kanjinia. So gover, there is always a reddish color maculopapular rash on the skin, but in the chickenpox, kanjinia, there are the macule, papule, vesicles, pustules, all the varieties of that skin lesions. We understand. Next important thing, basically in the measles, there are typical scoplic spot, which is a typical mucous membrane. There is a, what you can say, like an infection or the inflammation, maculopapular eruption at the mucosa of the gums, and especially in the second molar teeth. Above that, there you will see the whitish spots, which are called as a Koplik, Koplik, Koplik spots, which is typical feature of measles that you will not see in the chickenpox. So this is another difference. Measles, the rash will start from the head, face, neck over here, then the abdomen, then the extremities. Are you getting my point? So first it will start from the face. But in the what you can say, the chickenpox, the rash will be basically on the abdomen and then it spreads all over the body. Okay, so this is a comparison, but fever will be there, and measles is always started with some upper respiratory tract infection, cold, rhinitis, tonsillitis, pharyngitis, and after that, on the first day you will get this, second day you will get Koplik spot, on the third day little bit fever will come down, and from fourth to seventh day that fever with rash will be there. So these diseases are called as a exanthematous type of the problems. So measles are very infectious and it is a viral infection. So be careful how to protect it. As I am saying, this is a, according to Ayurveda, it is a kapha pitta problem because of the lot of congestions are there, secretions are there. That is a kapha problem. The part is of the kapha origin, and then the whitish mucosal spots, maculopapular spots, are related with the skin problem, rakta dushti, rakta heat, and so it is pitta related. So I can say that it can be the pittavruta kapha. Kapha is obstructed with the pitta problem. Okay. So in this way, understanding the concept of these measles, we will start to see the causes, then of course the investigations and Ayurvedic prescriptions or Ayurvedic medicine. But in all the diseases, you must remember Ahar, Vihar and Aushadhi is the tripod of management. Ahar is a food concept, Vihar is a lifestyle management, and medicine is a third part. Medicine is not the prime factor in Ayurveda. Etiology, mostly children ages 3 to 5 years, as I have told you always. So I will mark for you, my dear friends. This is best method. I found it very interesting method. Concentrate what I am telling you. So it is occurring in the 3 to 5 years, rare during the first 6 months of the life because of the transferred passive immunity from the mother. You are already strong because of your mother. Then causative agent is a myxovirus group. Mode of transmission, infection is transmitted by droplet or of secretions. Patients suffering from measles get out the virus from their respiratory tract during the prodromal period and for 20 to 48 hours after the rash appears. That time, that particular child is very infectious for the another child. Even there is a family, two brothers or the brothers and sisters, try to protect the other children, other your son and daughters from that particular infected child. It is not a serious disease if it is properly care taken. Incubation period means from the first infection that your virus is entered, and then after how many days that particular symptoms will start to develop. That is called as the incubation period, that is 8 to 10 days. That means history taking is very important in the measles patients. You have to ask the parents or the father and mother of that child whether the child in the school, have you found that his friends are any such type of infection. They say, oh, that one of his close friend was in our house 10 days back for playing and he had that afterwards the measles. So it may be from that particular child that your child has got that infection. Now we will talk about the treatment part. The first prescription that I have made over here, Chuta Shekhar, this is for Sama Pitta. That's why I have said that it is a Pitta Vrita Kapha. So there is a Kapha element is there. So it's like a Sama Pitta, because whenever there is an infection, Ayurveda says it's a part of Ama. Ama is like a toxin-like material. Ama can be created in two ways, endogenous or exogenous. So when there is a virus infection, this is exogenous type of the Ama in Ayurveda. So Sutta Shekhar tablet will take care of Sama Pitta, one tablet 3 times in a day by making a paste and mixing with the honey. If fever persists, then you can add Chandrakala Ras, 1 tablet 3 times in a day. Of course, the dose will depend on the age and weight of the patient. Pravala Pishtivati or Pravala Bhasma, 200 milligram plus Kamadudha, 150 milligram 3 times in a day. If fever subsides, then afterwards you have to give Paripathadikada. Paripathadikada is a very, very famous medicine for all rash type of the fever. Whenever there is a fever with rash or fever with bleeding, always remember, fever with lot of heat, Paripathadikada is anti-pitta. It is cooling down the Ushna and Tikshna properties of Pitta. That is why Paripathadikada, this can be used in the adult also to control the Pitta heat. If the lady is having menopause, hot flushes, then also we give the Paripathadikada. So Paripathadikada is not only for Govara, Kanjinia, measles and chicken pox, but it is a Pitta medicine, bitter type of the test. Because it will clear the toxins. So even it can be used as a skin problems. So in the skin problem also we use the Paripathadikada to remove the toxicity of the blood and heat of the Pitta. Okay. Next special note, take a special precaution and avoid the free mixing with the contaminated or the infected children with your child. So I think this is a short video regarding the common epidemics, that is the measles, which is found more in the winter season. There will be rash on the 4th day, remember, and Koplik spots are very much essential to diagnose the measles cases. Thank you very much. Take care and see you soon in the next video. Please don't forget to subscribe my YouTube channel. Thank you very much.